of you. I, Dr. Preeti Sharma, would like to welcome Dr. Indu Kashyap on the behalf of Parul Institute of Physiotherapy. So I just wanted to give the brief introduction about the man. So Dr. Indu Kashyap, she had pursued MPT in orthopedic. Apart from that, she also pursued MSc in counseling and family therapies. Okay, she certified in BLS by American Heart Association. She has been in work as practitioner at labor, child and lactation. She also been a practitioner at female sex health rehabilitation, pelvic floor dysfunction and pelvic girdle pain rehabilitation practitioner. She also been working as an operational safety and a health trainer, ergonomic and postural retraining, and also done the FIBA diploma in the football medicine. And right now she is pursuing diet and nutritional advisor diploma. Apart from that, ma'am has also a special area of interest in women health and wellness, ergonomic in all the settings and metabolic disorders. So right now, Dr. Indu Kashyap is working recently as a director and founder, Health Specific Physiotherapy and Wellness since 2019. Ma'am is also work as an head of the physiotherapy in Datta Charitable Hospital, New Delhi. She has also been a consultant physiotherapist by Dr. Rawat Gynecological Center, New Delhi. Ma'am also worked as a senior physiotherapist at First Physiotherapy, New Delhi. So this was the brief guidelines regarding about Dr. Indu Kashyap. Now I would like to hand over the mic to Dr. Indu Kashyap to continue further. Here to ma'am.
Thank you, Dr. Preeti, for giving so beautiful introduction of mine. I am Indu, and today I am going to talk about a topic which is rarely spoken, but it is very common. But before starting, I would like to thank Dr. Sandeep Parekh and Parul University for giving me so wonderful opportunity that I can talk on this topic, because suffering is so much it's present in India also, along with the whole world, but nobody is talking about. People feel very, people find it very taboo, that it is something related to our intimate part, and we should not be talking about this. So I'll be telling you the the roles, the functions of pelvic floor muscles, that it is not only your intimate muscle, it is way beyond that. So I'll start. Just give me a moment, please. Is it visible, the PowerPoint?
Yes, ma'am, it is visible.
Okay. So as I said, that everybody has pelvic floor muscles, right? Being human being, even the animals also have the pelvic floor muscles. So the pelvic floor dysfunctions equally affect everyone. It's not like that it can affect only the women. It can affect only the aging people. It can affect everyone, right from childhood to after even menopause. It can affect men equally at all the ages. It can affect all the communities, no matter are you from America or you are India. It equally affects everyone. So introduction is given by Dr. Preeti already. So this is the pelvic floor muscle. Can you see that the dark pink color is our pelvic floor muscle? And why we call it pelvic floor muscle? Because it is lying in the pelvic area. The pelvic area is the most below part of our trunk. So that area is called as pelvic. Since this muscle group is like in the form of a floor, it is making a floor, so it is called as pelvic floor muscle. It supports our organs like bladder, In women, it supports uterus also. The middle one is the uterus, and in the male, in male and female both, it supports the bowel, that is rectum, and it also supports their respective openings like urethra, which is coming from which is a part of bladder. Then we have vagina, which is a part of uterus, and then we have anus, which is a part of rectum. So as I said, that pelvic floor muscles are present in the pelvic cavity. So in the picture, this green part is our pelvic cavity. In the thorax, we have three cavities. The uppermost one is this violet one is the thoracic cavity, where we have heart and lungs. And then the pink one is the abdominal cavity, where we have the intestine and all the organs of GI tract, gastrointestinal tract. And then we have the lowest one part is the pelvic cavity, where we have three organs, as I stated, our bladder, uterus in women also, and then we have the rectum. These pelvic floor muscles are spanning the bottom of pelvis like a hammock, from pubic bone at front. See, now this is, you can see here. See, so this is the pelvic bone. This one is the pelvic bone. So at the front, it is surrounded by the pubic bone. This is the pubic bone. At the back, it is surrounded by the coccyx. This is the coccyx and the sacrum. And at the side, it is surrounded by the ischium tuberosity. This is the ischium tuberosity. So as I said, that it makes our pelvic floor. It supports all three organs. It is a dome-shaped kind of muscular structure. Dome-shaped, we can call it hammock kind of structure. We can call it a floor, or we can call it like a bowel. So it basically, what does it do? It separates the perineum area. The perineum is the lowermost part of our see, this is the perineum area. Can you see what is the perineum? The perineum is the anatomical region located just at the lowest part of the trunk, between our hip bones, between our thighs. So this the whole area is called as perineum. Right, so the pelvic floor muscles are lying in the perineum, and it is composed of levator ani muscle, the coccygeus muscle, and other associated connective tissues like ligaments and fascia. Okay, as I said, that perineum is the lowermost part located in between the thighs. So it is divided into two triangles. So the triangle, the one which is in the pink color, is called as urogenital triangle. As the name is suggesting, urogenital triangles means that here are the openings which are related to our genital. So here are the openings: urethra and vagina. Fine. And in male, it is only urethra. And in this blue triangle, this lower one triangle is called anal triangle. Here we have the opening called as anal opening, which is the continuation part of the rectum. Fine. Now we have very important structure while we deal in pelvic floor muscles and dysfunction, that is called as perineal body. So the perineal body is basically present just in between the both triangles, the urogenital triangle. See, the pink one is the urogenital triangle and the lower one is the anal triangle. So just in between this, we have the perineal body. And why I'm talking about the perineal body during this seminar? Because it's very important, because most of the insertion of pelvic floor muscles are at the perineal body. And it is a very it's a very strong structure, but often it gets disrupted during the labor and the childbirth. So we have to be very careful while delivering the baby, not to injure this part of perineum. Otherwise, if this gets disrupted, then we get pelvic floor dysfunctions. So in this picture, there are three layers of pelvic floor muscles: the superficial layer, the middle layer, and the deepest layer. So the superficial layer is basically comprised of the pink one. The pink arrows are superficial layers, right? The superficial layer means whenever we see someone from the downside, the topmost layer of the muscle after skin would be superficial layer, and this layer is basically responsible for our sexual activities mainly. And then we come to the middle part, and the middle layer and the deep layer both are responsible for our support actions and incontinence and continence functions, right? So what comes in superficial layers? Anal sphincter, and then we have superficial transverse peroneal muscle, and then we have bulbospongiosis, and then we have ischiocavernosus, and these are the muscles which are surrounding the genital. So you can see these are the muscles which actually are surrounding our genital openings. You can see in the lower picture, you can see that these are the muscles which are surrounding the genital openings. Now we have the middle layer. So middle layer we have deep transverse peroneal muscle, and then we have external urethral sphincter. This external urethral sphincter is like a gate which controls the urinary leakage. Fine. If this muscle gets disrupted, we can get the incontinence. Now we have the deep layer. The deep layer we have the pubococcygeus muscle. Somebody? Okay. Okay, now in the deep muscle, we have the pubococcygeus muscle, iliococcygeus muscle, and the puborectalis muscle. These three muscles comprises called as levator ani muscles. And in the deep layer, we have levator ani muscle, which is consist of three muscles: pubococcygeus, iliococcygeus, and puborectalis. And the second muscle is coccygeus itself. Now we have another musculoskeletal muscles: piriformis muscle and obturator internus muscle. Whenever we are talking about pelvic floor muscles, we have to talk about these muscles also. These are equally responsible for the functions as the pelvic floor muscles, because these are very closely associated with the pelvic floor muscles in the pelvic floor, in the pelvic cavity, and they share the same fascia. Fine. So this is the another pictorial presentation of all three layers. The pelvic floor muscles are like our water. You just think of a swimming pool or any river where we have a boat, and the boat is connected with the rope so that our boat does not go anywhere. So that ropes are responsible for the strength, for the support system, and also the water. If water will be less, then what will happen? There will be more strain on the ropes. As in the second picture, you can see that the water is very less, the blue part is very less, so the strain is more on the ligaments, our ropes. Fine. So ligaments are equally very important in while we are talking about the support system and other system or other functions of the pelvic floor muscles. So pelvic floor muscles consist of two fibers, as every other muscle consists of the musculoskeletal system. In this, we have 70% tonic fibers. So what does it show? And the 70% we have the phasic fibers. So as I said that the organs, all three organs and the two organs in the males they have to be continuously supported by the pelvic floor muscle. The pelvic floor muscle has to work continuously. So that is why we have more numbers of slow twitch fibers in the pelvic floor muscle, and where we need the 30% fast twitch fibers whenever we feel urge to go, whenever we have very strong urge. to defecate or to pass urine, then the pelvic floor muscles get tightened. So until and unless we get any sufficient at the right place, at the right bathroom, we don't, until and unless we don't get that place, the pelvic floor muscles keep on tightening so that the leakage does not happen. So in that case, the fast twitch muscles functions. Is it clear? So I will read it for you. The 70% slow twitch fibers are the tonic fibers, and they are always in the constant baseline activity because they are constantly working to support the organs and to maintain the posture. And the 30% fast twitch fibers are the phasic fibers. They work only when they required. They work when they work as a reflexive action to maintain the periurethral continence at extreme urge, and if there is any increased intra-abdominal pressure. Say for example, if I am going to lift something very heavy, so my internal abdominal pressure is going to raise. So in that case, if my pelvic floor muscles are weak, I can leak. So in that case, the function of 30% fast twitch fibers comes. Although in the GIF you can see the function. So in that case, although all layers of pelvic floor muscles are different, as I said that deep layer, middle layer, and superficial layer. So all the muscles have different functions, but all together they function as a functional unit. And normally they normally they contract simultaneously as a mass contraction, but the contraction quality and the contribution of each layer is different. But as a mass, as a whole, they contract together. And what is the how can you see that it is contracted? What is the function? What exactly is the action of pelvic floor muscle? It is the inward movement and closure around the pelvic openings. The pelvic openings mean the genital openings I talked about, that is our urethra, vagina, and the anus. These are the pelvic openings. So it is the inward and closure. If these are the openings, and this is the pelvic floor muscle. So what is the function? The inward and closure around the openings. That is why it is not leaking. That is why it is not prolapsing. And the coccyx, which is a bone present at the back, move ventrally, means towards the pubic symphysis. But these movements are very mild that you cannot see with your eyes. The true PFM cannot contract, as I said, that it does not involve any visual movement of the pelvis. The maximum PFM contraction does not seem to be possible without co-contraction of abdominal muscle. Abdominal muscle, that is transverse abdominis. So definitely, whenever we are seeing, or we are assessing, or we are teaching, we will see the movement of our transverse abdominis muscle along with pelvic floor muscles, definitely. So if a person is not able to contract initially the pelvic floor muscles, if the muscles are weak, then sometimes we take the help of transverse abdominis. Although the submaximal PFM contraction may be performed as isolated contraction. So if we want the maximum contraction of the PFM muscle, then definitely there will be co-contraction of the abdominal muscle, but submaximal contraction can be achieved in isolation without the contraction of transverse abdominis. Also, PFM contracts simultaneously with or proceed the increase in the abdominal pressure as an unconscious automatic co-contraction. So this is the nerve supply of the pelvic floor muscle and the perineum area. The major supply is through the pudendal nerve. So pudendal nerve comes from S2, S3, S4, as we all know, and it divides into the inferior rectal nerve, which supplies our posterior part, as the name is suggesting, rectal nerve. So it is innervating anal skin, external anal sphincter, and then it is further divided into clitoris, which gives the supply to the clitoris through the dorsal nerve, and ultimately it becomes the perineal nerve, which supplies our anterior part, means the whole perineum area. Now we have 6 functions of the pelvic muscles: support system, support organs. It supports our pelvic floor, pelvic viscera, and then we have it has very important role in stage 2 labor. Then we have a role in sphincteric, means incontinence, and then we have function in sexual activities. Then we have function in core stabilization, and then circulation. So let's discuss in detail. Contraction of pelvic floor muscles convert pelvic floor from basin shape to dome shape. Fine. So the orientation of pelvic floor muscle is like in this form. It is present throughout the downside. It is in the dome shape. So whenever it is contracted, it is converting into dome shape. When it is converting into the dome shape, it is able to give support to the organs. So this is how it supports our organs. Now it facilitates our childbirth. So in childbirth, how does it facilitate? First, during the pregnancy, during the whole pregnancy, the pelvic floor muscles are supporting our organs in normal. We are not pregnant, then also they support. But during the pregnancy, the weight of the baby puts more pressure on the pelvic floor muscle. So the function of pelvic floor muscles increases. So during pregnancy, the pelvic floor muscle training is very necessary, so that during the pregnancy or after pregnancy, we don't get incontinences, involuntary urinary leakage or fecal leakage issues. So that we don't get any organ prolapse. So during pregnancy, the antenatal classes and the postnatal classes also must include pelvic floor physiotherapy. Now, how does it help in during the childbirth? It facilitates birth by assisting the descent, means the descending of the presenting part of the body, means the head, causing the fetus to rotate forwards to navigate through the pelvic girdle during the crowning stage. The crowning stage is when the baby is visible down. So that is the crowning stage. The baby is coming down. Here in the GIF, you can see that the pink baby is very small. So it does not affect the pelvic floor muscle so much. As in the third trimester, the size of the fetus grows very drastically. So it affects pelvic floor muscle so much. That is the phase when some female feel urinary incontinence to some extent. And the another reason is that the pelvic, the uterus. This is the uterus, and the bladder is present in front of the uterus. So whenever the size of the uterus is growing because of the growing baby, it is giving more pressure on the bladder. So that is why normal capacity of bladder is around 600 ml. But since it is giving pressure, so with 200 ml or 300 ml of urine also, there we feel the urge because of the pressure coming from the upside of the uterus. Now the another function is the continence. Continence is the control of leakage, that is continence. So in that case, we have two kinds of incontinences we can have: the urinary and the fecal, means the stool. So if whenever the pelvic floor muscles, this is our bladder and this is our kidneys. So the urine is coming from the ureter, kidney, through the ureters. Ureters are two pipes and going in the bladder. And below the bladder, we have a gate. We have two gates. The internal gate, here you can see, this is the bladder in the first picture. We have the internal gate just below the bladder. And then at the below side, we have the external gate. So external gate is basically our pelvic floor muscles, which are the voluntary muscles, and this is under our control. So until unless we don't get the right place to urine, we can hold voluntary our urine. Fine. And now another issue we can have, that is urge incontinence. In urge incontinence, what happens? Generally, we see any pathology related with the bladder. In the stress incontinence, we see the pathology related with the pelvic floor muscles, that is external gate, external urethral sphincter, we call it. And in the urge incontinence, there is an issue with the bladder itself. So for example, if we have the pathology like interstitial cystitis, or we have any other spinal cord injury, then we can get urge incontinences. So these are the conditions where we have the urge incontinence. In the urge like in stress continence, we leak whenever we are doing the activities which increases our intra-abdominal pressure, like jumping, running, or lifting any heavy weight. In the urge incontinence, it is not related with the stress, but it is a very small amount of urine can give the signal that now it is the time to evacuate. I cannot fill in more. I need to contract. I need to void the urine. So with small amount of urine, we feel the urge. So there are more number of frequencies. It's like I need to go. I need to go. So the difference between the stress incontinence and urge incontinence is this. Now we have the fecal issues. In the fecal issues, the puborectalis muscle plays very important role. The pubic rectalis muscle is like a sling around the anus. It's like a sling. So whenever the muscle is strong, it can hold the stool in the rectum, in the anus. But if the puborectalis ring is weak, then definitely it is not going to hold it properly, and then we have the urinary fecal incontinences. We have the fecal leakages. Now the another function is core stabilization. In the core stabilization, we very well know that the core muscles, most of us know that the core muscles are transverse abdominis muscles, but our diaphragm, our pelvic floor muscles, our multifidus muscles, and transverse abdominis, these all four muscles together make our core system. So if any of the muscle out of four these core muscles get disrupted, it gives the symptom according to that. Say for example, if the pelvic floor muscles is weak out of these four muscles, then we get the urinary leakages. If a transverse abdominis muscle is weak, then we can get the hernia. We can get sometimes after pregnancy or during pregnancy, we can get diastasis recti. In the same case, if our back muscles are weak as a core muscle, then we can get the disc herniation, we get the low back pain. So whenever you are dealing with a low back pain, always consider pelvic floor muscles as well. So basically, is assist in the spinal unloading and spinopelvic stability, being the one of the core stabilization muscle. Now, it is very important the sexual activities as well. In the female, it enhances the proprioceptive sensation, but it is very important in the male. If these muscles are weak in the males, the male can get the issue of erectile dysfunction and premature ejaculations. Now it helps in circulation also. Like our calf muscles are always pumping and taking the blood towards the heart. So in the same way, our pelvic muscles is also giving a continuous pump kind of action for the blood and the lymph system. So if in case the muscles are not working well, we can get the pelvic congestion syndrome. Now we come to the dysfunctions. We can have definitely we have normal pelvic floor muscle in the middle. Then we have weak pelvic floor muscles, and in the last we have the tight pelvic floor muscle. Whenever the muscle is weak, it gives the it is not able to hold the organs. So it gives the symptoms like urinary and fecal incontinence and organ prolapse. But if the muscle is tight, so it is able to hold the organs, but it gives the symptoms like vaginismus, dyspareunia. Even if we relate it with the incontinence, it gives the symptoms like hesitancy. It increases. We feel the urgency because whenever we are sitting on a commode and we are trying to pass the urine, we feel the muscles are tight. We are not very easily able to pass the urine, so we feel urgent hesitancy. So these are the urinary incontinence symptoms of the tight pelvic floor muscle. And in the rectum part we get the constipation. Now we talk about the factors which are responsible to cause dysfunction. So this is very much related with the pregnancy, labor, and childbirth. As I talked about this thing, that because of the hormonal changes and the musculoskeletal changes, our muscles around the pelvic floor muscle and the ligaments are also getting relaxed. If these are getting relaxed, so our other muscles which are present there, like pelvic floor muscles, are also getting affected. As I told you in the analogy of the boat. Fine. So if our muscles are weak, it affects our ligaments. If the ligaments are affected, then it affects our muscle as well. In the childbirth, if the size of the head of baby is very big, if the size of if the weight of baby is around 4 kgs, if we use any instrumented delivery like forceps and vacuum, if there is increased duration of the labor, so these are the causes which can lead to injury to the pelvic floor muscle. Now, how does it is related to the obesity? The obesity is giving more pressure on the pelvic floor muscles. Fine. And now as I already told you, that the activities like sneezing, jumping, it very much affects our intra-abdominal pressure. If it is affecting intra-abdominal pressure, it affects our pelvic floor muscles as well, because that pressure is taken by all the core muscles, including the pelvic floor muscles. So it has to be very strong. Now the menopause. So the estrogen depletion related with the menopause is affects the quality of muscle. So the incidence of pelvic floor dysfunctions is very much seen with the menopause or with the aging. Now androgenic and the drugs. The androgenic means the are surgery related. So if a person just had a hysterectomy, so it affects. If a person has removal of ovaries or our uterus, so it affects our hormones. If affects his hormone, then it will affect our pelvic floor muscles as well. There are some drugs like if a person is on sedatives, then it affects our pelvic floor muscles, because the person is not able to know that where that person is present. Like for example, in the cognitive impaired, what happens if a person is in delirium, or if a person has a mental issue, that person has no sense where to defecate or where to urinate. So in that case also, this is another kind of incontinence we can see, which is related with the cognitive impairment. And the functional impairment means that your all functions, or your all physiology, anatomy is working well, which is required for the continence, but you are in the plaster of Paris. If you are constrained in the breast, or you are not able to walk because of any reason, maybe the place is very far, in that case you can leak. This happens mainly during the acute stage. So this is most of the times this is temporary. Now the core instability, I have already explained it, and there are some diseases like stroke, and then we have the spinal cord injury, diabetes mellitus, COPD. Why COPD? Because the diaphragm is one of the core muscle. like pelvic floor muscles. So if there is any pathology which affects our respiratory system, with time it will affect our pelvic floor muscles as well. Now the muscular sclerosis, Ehlers-Danlos syndrome. This syndrome is where when we have collagen, the collagen is present in all tissues of our body. So if the collagen gets affected in this syndrome, the supportive system gets affected as well. The urogenital diseases like cancer anywhere in the urogenital tract, or we can have the cancer in for example, also we can have the cancer in the GI system or any infection. It definitely can lead to pelvic floor dysfunctions like endometriosis. Also we have pelvic inflammatory diseases in which the uterus gets very much affected. And then we have some occupations and recreations. If someone has a hobby of if a person has the hobby like scuba diving, any activity which increases the intra-abdominal pressure can very much affect our pelvic floor muscles. And the occupations like if a person is working in the mine where that person has to cough very frequently, and then definitely it can lead it can aggravate already existing pelvic floor muscle, or even it can create new one. Now the diet, in the diet for example, it is very much common that caffeine or beverages, these are or any spicy food, citrus foods, these are some foods which are directly increases our symptoms of the incontinences and other pelvic floor muscles. Lifestyle habits, like if a person is working in a company and that person is not going very frequently for the loo or for any urination, so that person is holding the urine. Or if a person is slouching forward, that means that person, the pelvic floor muscles are not getting enough space to work. Or if a person is shallow breather, in the shallow breather, we are taking short breaths, very frequent short breaths. If we are taking the short breaths, we are not giving enough contraction and relaxation to the pelvic floor muscles, since the diaphragm and the pelvic floor muscles work in coordination. Smoking and substance abuse, their incidences are also seen that it affects the ciliary function of our tract. So we must advise a person to quit these things. Now in the management, we should prefer biopsychosocial model by the multidisciplinary team. What does it mean? That it is not only not the physical part that a doctor should treat it, even there has to be team, the social part. And bio means the mental part should also be taken into consideration while managing such patients. So the team should consist of a physician, surgeons, physiotherapist, occupational therapist, nurse, an educator, psychologist, sex therapist. Sex therapists are required whenever we have the vaginismus and dyspareunia. That happens due to the high tone pelvic floor muscles, the tight muscles, a pain specialist, dietitian, because there, as I told you, there are some foods that affects our pelvic floor muscles functioning, and the social activist, because people are not coming up in front to get the treatment. So we have to create so much awareness around that. This is not a taboo. This is a muscle like any other muscle, and as you can get the frozen shoulder, you can get the pelvic floor dysfunctions also. We have to create the awareness. Now then everybody must understand, acknowledge and respect each other's job. We should have the knowledge that what is the function of occupational therapist, what is the function of dietitian. Then only we can referral. The referral is the key. Now before managing, we have to take care of prerequisites. Means the room should be there. We have to maintain the privacy. There should be enough light. We have to have a lithotomy bed. A bed, it's a kind of bed on which the legs are at the upside, so that you can very easily examine the perineal area. So these are some prerequisites. The contraindications are like if after within the 6 weeks of delivery we cannot do any internal examination, or if a therapist has no enough knowledge of internal examination, that person should not go for any internal examination. These are some prerequisites. The other one is that the client, if a client is less than 18 years of age, then we must not be doing any internal examination. Pregnancy is a relative contraindication, not the absolute indication. Contraindication, we must talk to our gynae before doing any internal examination in the pregnant ladies. Fine. So in the examination, we have to follow all those rules which are applicable on any other musculoskeletal neurological conditions, that is SOAP, subjective, objective assessment, and then physical examination. So in that case, we have to look for the perineal area and abdominal area for any masses, for any inflammatory changes. We do the internal assessment and the external assessment for any nodule, for any trigger point, for any tenderness. There are some special tests done for this. For example, the cough test. We ask person to cough. If it's that person is leaking or not. We have some pad test. We ask person to wear the pad for 1 hour, for 24 hours. It depends on how much she is leaking. We ask her. We teach her how to fill the bladder diary. We have bowel diary as well. In that case, we ask person that please fill whenever you are eating or drinking, and then in how much time you are feeling urge, and how much time you are going, and how much are you evacuating ultimately. So the bladder diary consists of everything, and it gives the idea that how the person is working. This should be filled in at the baseline, and with every 2-3 weeks, so to see the progression. And always exclude the red flags. If there is any red flag, like if a person has a constant pain or very severe pain, then it might be related to cancer or any. Just look out for any red flag and just give this direct referral. Please don't treat that person. And always talk about the function, not only your function as a physiotherapist. Tell them that all these are other options are also available. The surgery is also available. But when you need a surgery, if this is the case for the pelvic floor physiotherapy, then tell her that this is the case for physiotherapy, but unnecessary. Don't keep the patient. Just see if the patient requires any surgery. Please refer the person. Say for example, in the prolapse, the first degree and second degrees are very much treatable with the pelvic floor physiotherapy. But if a person has any third or fourth degree, in the fourth degree it is clear cut a surgical case, and we must send to the surgeon. If it is established that the patient requires pelvic floor physiotherapy, then we have to set the goals, the short term and the long term, and we have to educate the patient and counsel, because this is a condition where people feel very embarrassment about talking it, and the life of quality is getting very affected because the dysfunctions related to this affects person so much. If it affects a person's sexual activities also, it gives tremendous pain. It gives you have the leakages. So in that case, a person need a good counseling. If you think you can refer to a counselor, and then educate person like about all what diet you have to take, what is the condition, how much time can it take, and what are the success stories. Just tell person everything, what should be your posture, just talk about the ergonomics. And in some cases, if a person has dyspareunia or the chronic pelvic pain, we ask person to strain from the sexual activities. So these all things come in the education part. The pelvic floor physiotherapy is a specialist area within the field of musculoskeletal health that involves the non-surgical treatment of the pelvis and the pelvic floor. The advanced physiotherapist assess, treat, manage patients with the issues associated with the pelvic floor dysfunctions. These dysfunctions are incontinence, pelvic girdle pain, pelvic organ prolapses, abdominal muscle separation, that is we can call it diastasis, constipation and sexual dysfunctions, and there are so many. Fine. And the pelvic floor physiotherapy is also an integral part of pre and postpartum care. As I already told you that the hormonal changes, the musculoskeletal changes, and the growing baby put so much pressure on pelvic floor muscles. So it is very imperative to have antenatal and postnatal pelvic floor physiotherapy and assessment. The assessment part, I think in some countries it is mandatory to have postnatal and antenatal check along with the gynec follow-up, but it should be done in our country as well. In some countries, even a person is approaching for pelvic floor, pelvic organ prolapses. So the 3 months physiotherapy is must. Fine. So we must educate patients and the doctor as well that we have the role in these situations. The pelvic floor, and not only in the natal cases, it should be incorporated with the pulmonary rehab as well, musculoskeleton, because this is a part of our core muscles. Now, the pelvic floor physiotherapy is recommended as first line, low risk, minimally invasive therapy. It has been established. You can very easily apply this pelvic floor physiotherapy in initial grades. Assessing the pelvic floor without doing internal examination is like orthopedic surgeon or a physiotherapist doing an examination just from the person, the doctor is not exposing the pant at the knee and just doing all the examination from above the pant. Then how can it be possible to get the exact picture? So in the same case, the internal examination is a kind of must thing in pelvic floor physiotherapy. If a person is not comfortable, take your time. In my practice or in general also, usually the females, I treat the female pelvic floor dysfunctions, not the male. The female are not comfortable at first or second visit, but as with the time you develop the rapport, you make them understand, you counsel and educate them about their pelvic floor muscles and everything, so they feel that they give you the consent. And never do internal examination without written consent. Treating any other part of the body without touching the affected part to see which muscles are tight or weak, how they are working, how the joints are working, it's completely unacceptable in any practice, not only in physiotherapy. The physiotherapist who carries out this work is a highly trained and sensitive professional. Why I'm saying sensitive? Because this is the pelvic floor dysfunctions. People are very sensitive. People don't talk about these things. So the physiotherapist also has to take care of their language while dealing with the patient, who will discuss these issues with the patients thoroughly before carrying out the treatment. Internal palpation is an integral part of treating the pelvic floor, and it is the gold standard in the management. In rehabilitation, since it is a striated muscle, as like our biceps, triceps, our calf muscles, any other muscles of the body, it follows the same rules like these muscles. So we start with the motor relearning. Motor relearning is very important in pelvic floor muscles, because the biceps of the person is able to see the biceps, so you can very easily show and tell and make them understand the function, how this muscle is working. But the muscle of pelvic floor is situated lying down, and the best part is that we never think about these muscles, so it becomes very hard for patients to understand its functions and how does it work. So we give the cues. The therapist uses her or his finger to take inside the vagina or the rectally, and we ask person to please grab my finger. Yes, you are grabbing nice. So these are some cues. We ask person to we give the cues like just feel it like you want to leak the gas, but ultimately you are in a public and you don't want to leak gas or urine, whatever you can say. So you hold that for some time until unless you get the right place. So that holding is happening because of the pelvic floor muscle, and that is the right function. So these are some cues we ask. If all the cues, verbal cues, are failed, then we use the biofeedback, electrical biofeedback. And in the strengthening and the flexibility part, if the muscles are tight, we must start with the flexibility. Until unless a muscle has a good length, we cannot strengthen it. So in the tight pelvic floor muscles, always lengthen the muscle first. Never do the Kegels in the tight pelvic floor muscles. You will aggravate the problem. Okay, so strengthening. How does we do the strengthening and the endurance? We ask person to contract and the relax. Contract and relax. There should be full relaxation. There should be full contraction and full relaxation. It should not be like this. Fine. So this very much you can understand with the help of your finger inside the client. And we ask person to hold for 1 second, and then slowly and gradually we ask her to increase her frequency. We ask her to increase the duration. In the endurance exercise, we ask her to increase the duration of the contraction. Slowly and gradually we can use the cones. Here in the down picture you can see these are the vaginal cones in which we have the weights. These are the weights. So initially we start with the lowest weight, then keep on increasing the number of weights in the vaginal cone. So you must be noticing that the rule of rehabilitation is same for the pelvic floor muscle. It's just that the way of doing is different because the location of muscle is different. Now we have to do the functional training as well. In the functional training, what we do, if a person is leaking while taking the baby up, or while taking any pot from kitchen to dining table. So these are some issues. So we simulate these activities in our clinic. We start with any ball or anything you can take, and slowly and gradually ask person to do same exercises in the real life scenario also. But the main problem seen in this stage of rehabilitation is that people think that now I'm able to control my incontinence, or I'm able to do sexual activities. Now I should not go beyond. I'm doing well. But when they ultimately go in the real life situations, they again start leaking. So the functional training with the help of physiotherapist is very important, which comes after which may come after 4 or 6 months or maybe 8 months. It depends on person to person response. How are they doing? And at this stage, people are not very compliant. Home exercise program is very important in the pelvic floor muscles, like all the cone muscles, or all the muscles you are doing. Please give them for the home exercise program as well. Now, the pelvic floor muscle is nowadays way beyond the Kegels. Earlier, it used to be, even today also, so many patients comes to me and they say that they know so much about Kegels muscles, Kegel exercises. These are the Kegel, but believe me, we must create the awareness that don't go with the Google, because the Kegel exercises can actually harm. It is not useful in all the pelvic floor dysfunctions, and it can harm in some pelvic floor dysfunction. Say, for example, in the case of tight pelvic floor muscles, because Kegel exercises are the strengthening exercises. So if you will strengthen further, you are contracting already contracted muscles, so it will aggravate your problem. This is the last slide of the presentation. Here you can see that this is the middle part. Here we have the in this circle we have all the openings, the urethra, vagina, and the anus. We ask person to lift upward. So this is the normal function, and we ask person to hold it. In case of endurance training, we ask person to hold it, and then we ask her to please release the contraction completely. Okay, and then this is the action we ask person to perform, and the internal examination and internal motor relearning strategies are the key. And if a person is not comfortable, please try to make her comfortable. And yes, and the epidemiology, if we talk about, it is very common. As I said, every 1 in 4 person is affected, but nobody is talking about. I don't know if I am in a house that in my relative or in a marriage, that how many people are suffering. 6 or 7 years back, when I started practicing completely in this, then I started asking my relatives. I started with my relatives. I asked them that, do you have such symptoms? And I was very amazed that every third lady in my family have either incontinence or some kind of prolapses. So it is that common. So please look around, start with your community. They need your help. There's a study done in 2012 in India. It was concluded that out of 100%, 34% of the female, they don't know that which specialist they should go. 22% were very shy, and 31% thought that it is a passing problem. It happens with aging, and maybe it will go. Otherwise, everybody is suffering. It's okay. It is normal. So these are some really myths which we should be we should eradicate from our society. And people don't know even that who all are the point of contacts. We must aware we must create awareness that what all helps are available and where are the helps. After surgery also, the pelvic floor physiotherapy is very important to decrease the chances of recurrences. And sometimes after surgery, we have associated issues like if a person is getting surgery for a prolapse, that person can after surgery may develop incontinence. So post surgery physiotherapy, pelvic floor physiotherapy is equally important. So thank you. That's it from my side. Any questions I'll be able to take now. And these are my contact details. In case if anybody want to contact me, can directly contact me, and I am always ready to help for women cause especially. So thank you.
Yes, ma'am. Thank you very much. So much, ma'am, for enlightening us with the knowledge and the experience which you have in the women's health. And you have shared a very nicely. You have shared it in a short way, and we were very fruitful that we can able to learn so much about or get aware about so much regarding the pelvic floor muscles. Yes, ma'am. In India, it's like 90% of population are suffering from that condition, but still they are not aware that whether there is such kind of physiotherapy or such kind of treatment which is available.
Available even, yes.
Yeah, that's true. And if they are suffering, they won't explain, or they feel shy to explain their experiences or the feelings they are having. So that's why it is good that
So
you are.
yes, as a physiotherapist, whether you are working in pelvic floor physiotherapy or not, but as a physiotherapist, as a medical professional, as a person who has some knowledge about pelvic floor muscles and dysfunction, we must create awareness. Outside, women are still getting so much aware, and they have started talking about in other countries in European and America. But in India, we need so much work. We need so much work.
So that's why, like, thank you for everyone, students and the viewer, paying attention for this valuable topic. I hope everybody has learned a lot about the roles and the responsibility, which is important as in not for the women's but also for the men's. That there is need to strengthen your pelvic floor muscles so that it would not cause any future complications.
Yes.
So
Even in school also, even in school, from the early age we must start the pelvic floor exercises. There are some contraindications, like during the pregnancy, female just go through the Google and they start doing the Kegel exercises. So I want to tell you here that overdoing of pelvic floor exercises, the Kegel exercise or any strengthening exercises, tighten the muscle so much that it can affect even our child, even our delivery also. So the length of the muscle, the strength of the muscle should be optimum. So it can be done only with the help of some specialist, that how much you require, where are you right now, and how much you have to go further. So never do any strengthening exercise on your own. This is a message for the general public.
yes, ma'am, so true. Ma'am, right now we don't have any such questions. So if a students, if they are having, they can directly mail you or directly contact with
Sure.
you.
Sure.
Yeah. So
Okay.
so because of short span of time, so we are ending up the session. Thank you so much, ma'am, for giving you your valuable times for
Thank you.
us.
All honors mine. Thank you. Thank you.